We welcome in cardiothoracic surgeon, Emmy Award-winning television host, and now the administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Dr. Oz, thank you so much for being with us and for your service to the country. You certainly didn't need to do this, but you wanted to serve, and I hope Americans appreciate that, sir. First, let's talk about the challenge of prescription drug prices. Why do Americans pay so much more for drugs than patients in other countries?
Because pharmaceutical companies could get away with it. And this powerful executive order only came out because we have a president with remarkable fortitude, willing to take the withering pressure that's going to occur and has already started. That stated, there's a lot of good reasons to have an executive order to address what you just described, the inherent unfairness of Americans spending so much more than Europeans. And in that executive order announcement, there was a chart to my left, and we pointed out that there's about a 2 to 4 times increased cost of medications in the United States compared to other competing companies that are similarly wealthy as we are. This makes sense. As the president pointed out, we are literally subsidizing their healthcare systems, and 70% of the profits of the pharmaceutical industry are coming from Americans. Now, let me take a step back from this. All of us believe in the remarkable innovative spirit of the pharmaceutical sector. We've cured cancer, we've treated autoimmune problems, underlying psychiatric issues. There's all kinds of advances being made with these medications. So we want the creativity to continue. What the president is arguing for, it's very rational, if you just take a step and listen to it, is get other countries to pay more so we don't have to pay as much in America. If we do this the right way, pharmaceutical companies will continue to remain profitable. We want those workers and those researchers thriving, but we want to make sure the American people don't overpay for their medications.
So just so we can understand the economics of this and understand how the competition works, these countries all have their drug formularies, they have their own marketplaces, and they're making their own separate deals with the pharmaceutical companies, and those pharmaceutical companies are also being subsidized to one degree or another by those different marketplaces. But that has resulted in Americans subsidizing the rest of the world. An executive order, it's important, but it can't really force them to do this. How do you now go about restructuring these arrangements between the United States and the pharmaceutical companies, or the pharma companies and these other nations?
Well, Tom, you beautifully summarized the scenario as it is. Those countries in Europe, Asia, have negotiated more effectively than the American government has been able to negotiate for the American people. And so if you let the private sector do things, they'll try to make money. That's what they're hired to do. And sometimes they'll make more money in one area than another, depending on how well folks are negotiating. Right now, we have a crisis in America. 2/3 of Americans who are going into bankruptcy go bankrupt because of healthcare issues, like the price of medications. In fact, the medications are so expensive for so many Americans that about 1/3 of the time, patients aren't able to take their medications. What is it like to be able to know you've got health at the tip of your fingertips, if you can just get it from the pharmacy, but you actually can't afford to get the help? The trade-off we're asking the American people to make is, do you want to be healthy or do you want to be bankrupt? It's your choice, right? And so, unfortunately, that's not a good option, especially when you've got members of your family who desperately need these meds. So that creates a tremendous amount of pressure on the pharmaceutical sector. They don't want to be vilified. They don't want to be the bad guys. So the president said, he's a great negotiator, I don't know of a better one, is go out and talk to these guys. We bet, and we have already been approached by 6 of these companies, that they want to talk. They know this is not right. The question is, how do we correct everyone is in agreement can be done better? Can we come up with better solutions? Again, we don't want to hurt the industry, destroy the industry. Just want to do something that's fairer for the American people.
Right. Now, do we need some sort of reform with respect to patents for drugs, streamlining approvals that would enable companies to have longer to recoup their costs and bring their costs down for production?
Tom, you're so right on this topic. And, so often people focus on the actual money, but it's really about the creative. That's where all this actually value comes from. So right now, pharmaceutical companies will get 1 in 20 of their best products actually to market where they can sell them. And oftentimes it takes them years and a lot of money to figure out that they have a product that doesn't work. So we can streamline that process, get the regulatory engine moving more rapidly. I've talked to my colleague, Marty McCreary, who's head of the FDA, and Secretary Kennedy. We're all on the same page on this. We can streamline the process. In fact, once the FDA approves products, they don't always immediately money get reimbursed by CMS, the agency that I'm in charge of administering. So we can do a better job even in that regard. So let's get government to streamline the process, make it easier for companies who have great ideas to be successful, but in the return, we don't want the American people overpaying. Yeah. We want the same deal that other countries are getting. We want most favored nation status.
Exit question for you, Doctor. I want to ask you about Medicaid reform. Obviously, it's a big topic on Capitol Hill. Democrats and many Republicans reticent to tackle reforms to make the program more efficient. You're new to government. Have you been surprised by the pushback against even fighting waste and fraud in the system? And real quick, how big of a challenge is abuse of the system by states? And is that something that you're looking to tackle?
I am new to government, but I'm not new to politics. I was on the faculty at Columbia, and that's real politics. So I know what it's like to have your protected areas and people not want to step on each other's toes. But this is not an issue, in my opinion, that is a difficult moral one. We have a need in America to give help to the most vulnerable Americans. Every great nation is judged by how well it does that, and we're going to do it as well. The question is, what do you have to do to reciprocate? So if you're an able-bodied person who's had some bad luck and don't have a job and you're not making money, so you want to have health care, that's fine. We should support you. But you should be willing to show us that you want to try to get better or at least engage in society. So are you trying to get a job? Are you getting an education? Can you take care of a family member who's ill? Can you volunteer? Just show that you have some belief in yourself.
Right.
And so if you can do that and have some agency about what you're up to in life, that's all you have to really do to be able to continue to get free health insurance. Yeah. That should not be a difficult debate. But of course, it gets vilified in some of the press. And for that reason, people get scared of being hit hard on these issues by their constituents. I am confident that the legislature, that Congress will do the right thing. They'll make a decision that should have been made years ago. We have work requirement rules in place for the SNAP program. Right. To get food stamps, you have to at least try to get off the dole. The same should be the case for Medicaid. Most people will, by the way, they'll try to get a job. They want to work. This will give them additional impetus. It shouldn't be a problem.
Dr. Mehmet Oz, a lot of Americans are counting on your success, and we're certainly going to be following your progress. Thank you so much, sir, for being with us.
Thank you, Tom.
Information. Truth is freedom. Is Newsmax. It's real news for real people.